At each stage in life, there are certain qualities and needs that all people share. As healthcare workers, we need to understand each of these stages so we can offer our care and our experience in ways that are appropriate to that group. Age-specific care addresses the different needs people have at different ages. This program is the second in a series of programs that will cover age-specific considerations for every stage of life, from neonates immediately after birth to those over the age of 80. This second program in the series covers age-specific care for toddlers through teens. By incorporating age-specific considerations into your care for children, from toddlers through teenagers, you help identify and provide the care that particular person needs at that time of life. You help the person become an active partner in health decisions as much as the person's age makes possible, and you will help your institution comply with accreditation standards established by the Joint Commission. Age-specific competencies have been a major focus of the Joint Commission. Healthcare staff need to be trained on how the age of each patient can impact assessment and delivery of care, plus the health education needs for the patient and family. There are special health considerations to be aware of at each stage of life, and all healthcare staff should understand and apply these age-specific considerations. To do this, you should also be aware of the family's culture and language. America is a very culturally diverse country and becoming more diverse all the time. There are many cultural differences in beliefs, cultural practices, eating habits, and physical environment. Many of these can affect a person's health directly or affect the attitudes that define how health is maintained. Understanding cultural differences can be especially important in working with children because their family may have different views of the role of the family in making personal decisions. If you work with a minority community, you should learn when it is appropriate or even essential to work with the entire family on making medical decisions. In addition to strong cultural factors that can affect age-specific care, there may be direct language barriers.
Yo el inglés casi no.
You should assess the patient's and family's primary language and whether communication might be clearer if you brought in a translator or an interpreter. Also check for any speech or hearing impairments and check whether any confusion or depression might be a sign of physical or mental illness. With children and teenagers, check to see that the person appears to understand instructions at an age-appropriate level. One way to do this is to ask them to tell you what they understand about their disease or condition, or what was just explained to them.
So I need to finish all my medication, even though if I feel better before it's gone, or else the infection could come back.
That's right.
Cultural understanding and clear communication with the patient can be keys to providing age-specific care. In this program, we will now look more closely at age-specific care for different ages. We will start with young toddlers from the age of about 1 year to about 18 months. Young toddlers are in a period of extremely rapid growth and learning. They explore the world by crawling fast and then toddling uncertainly through it, touching, looking, listening, and smelling. They may begin to look at and imitate reading books and play with writing toys and pool toys. And they progress in their efforts to communicate, jabbering expressively using a handful of words.
Take it off. Take it off.
They easily show emotions such as joy or anger, and they respond to boundaries such as firmly saying no or no, no. Even young toddlers can imitate simple acts, and they know the names of several people. They can often shake their heads for no and nod for yes.
Should we change your diaper?
And they often indicate when their diaper is wet, for instance, and make other needs known. They often learn to scribble in imitation of adults' writing and make crude drawings.
Where is pointer? Here I am. Here
They love repetitive songs and simple videos that repeat actions. Parents should be encouraged to speak to the toddler, but they should not be frustrated if the toddler can only meaningfully use a few words at this stage. By the age of 18 months, some toddlers may comprehend as many as 50 words. When toddlers are brought into a healthcare setting, ask the parents if the child seems to be developing motor skills normally and if they have noticed any hearing or vision problems.
And how about his language? How is that going?
He's combining words. He's doing well, yeah.
Remind the parents that children develop at different speeds, and if the toddler seems slow to walk or talk, reassure them that it may be perfectly normal.
You noticed any symptoms like fevers, runny noses? Because she is in daycare, so
Look for and ask the parents about any signs of colds or flu, and remind the parents that these conditions are very common, especially among toddlers who attend daycare or spend time with other toddlers.
And it is important to keep in mind hand washing, getting rid of germs is really important.
Parents should be told about the importance of frequent hand washing, their own and the toddlers, as a way to prevent disease transmission. Check the toddler's teeth and help the parents understand the essentials of basic tooth care, brushing all surfaces of the teeth twice a day with water, even for 1 or 2 teeth. Smile and talk directly to the young toddler. Encourage the toddler to communicate even if there is only a babbling reply, and encourage hugging, cuddling, and touch by staff and especially parents.
Good boy. Love you.
This will promote healthy bonds and good parenting. Be aware of the problem of stranger anxiety and try to limit the number of staff workers assigned to each toddler.
You want to show me your arm? Show me your arm.
Always speak to the toddler before a touch to avoid startling the toddler. Honor the parents as partners in any treatment for the toddler and try to calm any anxiety they are feeling about their child's health.
No.
Use a strong but not punitive no if the child is in danger. The child is likely to respond favorably, and this will model how to set appropriate limits for the parents. The safety seat is still required with toddlers. You should make sure the parents have not grown lax on the use of the car seat just because the toddler has grown larger. Often the seat may need to be adjusted, or a larger toddler seat may need to be purchased. Even though the toddler is growing, diaper changing areas need to be kept clean and functional, capable of changing a larger child. And as the toddler becomes more capable of walking and running, the parents should be reminded to watch carefully at streets, parking lots, and even escalators and elevators. Sometimes it takes only an instant of inattention to allow a running toddler to get into danger. Older toddlers from the age of about 18 months to 3 years are maturing and learning rapidly and beginning to develop a sense of autonomy. This is when sphincter control develops and potty training becomes possible, and they begin to imitate the parents, especially in household chores. They begin to show independence and can climb stairs alone. They know their own body parts and can run, jump, and start riding simple tricycles. They can show a strong sense of ownership and may develop a streak of stubbornness and be less willing to comply with requests. This is not an age of sharing. There may even be strong temper tantrums and the onset of the defiance of the famous terrible twos. By 2, many toddlers will make attempts to spoon feed themselves, and by the age of 3, most toddlers can feed themselves completely.
I need one more.
They can now talk in 2 or 3 word combinations and then short sentences. They may develop a vocabulary of 300 words or more. They will usually imitate the speech patterns of adults. They will often start verbalizing their needs, first as demands, and they begin to understand adult requests, though they may stubbornly refuse to obey. If there is any need for the parent to be separated, reassure the toddler. Separation anxiety can be intense. If necessary for reassurance, examine the toddler or perform simple procedures in the parent's lap if possible. Smile and talk to the toddler and the parent in a calm voice. Several inoculations are due at this time. Make sure the parents keep all immunizations up to date and encourage them to visit the dentist regularly. Ask if there is any toy the toddler would like to hold. Often a stuffed toy or picture book will provide a distraction from threatening surroundings. Try to put yourself on the level of the toddler when you speak. If the toddler does throw a tantrum, try to protect him or her from harm. Enlist the help of the parents and protect yourself as well. You could be bitten, kicked, or scratched. If the parents ask medical or behavioral questions, try to explain in the simplest way. If you have to use medical terms, explain clearly what you mean. Use of a car seat is still required. Laws vary state by state, so be sure to know and remind parents to follow your state's requirements. This is very important to emphasize with the parents of restless and adventurous children who may learn how to unlatch a seatbelt and try to wander around a large vehicle such as a van. Parents should be encouraged to explain in simple terms and set limits concerning the dangers of certain behaviors or objects. Toddlers at this age are very curious and may attempt to mimic the parents in the use of tools or other household objects that they cannot control. As the child passes the age of 2, temper tantrums and other negative behavior may continue for a while before the terrible twos give way to the curiosity of the preschooler. The preschooler, from 3 to about 5 years old, often remains egocentric, yet begins to think in more social ways, raising issues like guilt, sharing, and concern about the smallest slight or unfairness. By age 3 or 4, nighttime bowel and bladder control should be achieved. The preschooler can perform simple self-care like brushing the teeth and lacing shoes. Preschoolers increase their speed and agility at many tasks, and by age 5, most can use a pencil and scissors with dexterity. Their minds begin to use symbols, and they play with imagination, fears, and stories. They identify with their parents, but grow more independent and begin to become sensitive to others' feelings. Key needs at this age are for praise and clear rules to provide a secure set of boundaries. By this age, at least 75% of their speech should be intelligible, and they should understand long and complex sentences. By the late preschool age, children should be picking out simple written words and maybe reading a little. Preschoolers often appreciate a Band-Aid for small scratches and injection sites. The healthcare worker should work to involve both parents and children in healthcare choices.
Hey Edgar, let's see how warm you are today, okay?
Always explain what you are going to do in a firm and direct way before you start. Don't lie to the child about whether something will hurt, but reassure them that it won't hurt for long. Injury and disease can be very upsetting to children.
The ear hurts.
Do people die if their ear hurts?
Yeah.
Children at this age tend to weave fantasies so that a minor wound may suggest that the whole limb is about to fall off. Explain healthcare issues clearly and reassure the child. Preschoolers are often more cooperative during physical exams when they're allowed to participate in some way. Let them look down your throat before looking into theirs.
See, I'm doing that. Now I want you to do the same thing when I press on your tongue.
Use toys and games to help teach the child and reduce fear of health issues. Use talking, singing, and distractions like colorful stickers to divert attention from frightening procedures. Encourage the child to ask questions and talk about his or her feelings. Parents should be encouraged to teach the preschooler about safety equipment, such as bike helmets and elbow and knee pads for skateboarding. Fire safety and pool safety can also be issues. Explain in simple terms why certain risky behaviors are dangerous. The school-age child from about age 5 to 8 gains greater muscle strength and coordination. Pre-puberty growth continues slowly, and they often like rough and tumble play. Children at this age become mentally active, eager learners, and love to share their knowledge. While they are developing a greater sense of self, there is also a great need to fit in with their peers. School activities and social games can become very important. They perfect their reading and writing skills and learn simple math skills. Their attention spans gradually lengthen and they begin to tell time. They can use language correctly and give their own address and telephone number. At this age, vital signs are approaching the norms of adult parameters.
We're going to give you a shot today. Which arm would you like to use? This arm? Okay.
The healthcare worker should explain procedures in straightforward terms using correct terminology, but in a way and with language they can understand.
So that wasn't so bad, was it? Okay, you were brave today.
Remember that they are modest and proud. Provide privacy if necessary and build into your teaching rewards and praise.
Ella, if you were going to pick a snack today, which one would you pick?
This one.
I think most kids would probably pick this one, but this has sugar in it also, but it's a healthier kind of sugar.
Do your best to guide the child toward healthy lifestyle and safety choices.
Why is it healthier?
Habits formed at this age may last a lifetime. It's not too soon to begin to discuss exercise and nutrition and maintaining a healthy lifestyle. Include the parents. School-age children often enjoy actively participating in their examination and care. If possible, allow them to make some choices about the care. If equipment is needed, allow the child to examine the equipment ahead of time. You should allow longer training and teaching sessions. As children are maturing sooner and are bombarded with information on television and from peers, it is not too soon to begin to learn honest but simple information about alcohol, drugs, and sexuality. It is also time to begin learning playground safety habits and how to resolve conflicts peacefully. In the preteen years, many children achieve the growth spurt of puberty ahead of others. Some feel awkward and alone, while others feel left behind. Preteens are curious about many things, enjoy exploring and making things, and are often very ashamed of failures. They become peer-oriented and may spend less time with their families. They may prefer companionship and play and are prone to disputes.
I don't care what you say. I just want to be by myself right now.
Older preteens may have outbursts of rebelliousness and anger, may withdraw into solitary play, and may need reminders about personal hygiene. Preteens can often participate fully in conversation with adults. They can become very verbal and express their feelings strongly. They are becoming interested in the world beyond the home and their immediate community, and they are beginning to make logical assessments of what they learn.
Oh, Roxanne, we're going to have a little look at your...
At this age, vital signs are at the norms of adult parameters. Serious sexual questions may arise about personal appearance, sexuality, and pregnancy and should be dealt with honestly.
Well, you've got a nice smile on your face. How you been feeling?
And help the parents talk to the child about crucial issues of peer pressure around smoking, sexuality, and all kinds of substance abuse. It can be difficult for parents to know how to initiate these discussions, and an outside authority, such as a healthcare worker, can be a big help in getting the ball rolling. Preteens often have a strong sense of modesty and shame, respect their privacy, and keep them screened or covered when possible.
What's been going on with you?
If you notice worry or anxiety, provide comfort and reassurance. Preteens often feel they are the only persons in the world to experience emotions such as keen loneliness or a painful breakup of a relationship. Interact with honesty and respect. Explain safe behavior using logical explanations and reasoning. Talk about the effect of peer pressure and finding appropriate role models.
So do you know any kids at your school that smoke or do drugs?
Discourage smoking and drinking and point out that in most states, smoking is illegal until 18 and drinking until 21. This is an age of risky showing off, especially for boys, on bicycles, skateboards, and other sports equipment. Try to awaken a sense of responsibility to their own bodies and their families. By the early teens, from 13 to 15 years, almost all teenagers have passed through puberty and they are trying to forge their identity in a complex world. The average onset of menarche is now 13. This is a period where the body transforms into an adult, sexually mature body, and physical appearance becomes increasingly important. Acne may occur because of increased secretion of androgens. At this age, adolescents are able to entertain complex moral thinking, and they begin to make up their own minds and choose their own values. They are often extremely idealistic. Early teens are able to read subtle signs in others relating to social class and chosen social groups, and they are very sensitive to one another's emotional states. An interest in the other sex and dating becomes stronger, and being left out or spurned can cause extreme reactions. At adolescence, you should begin looking for signs of common adolescent health problems, such as nutritional disorders, obesity, anorexia, bulimia, acne problems, STDs, substance abuse, pregnancy, and any stress-related problems.
How are things going for you this year at school?
This is a stress-filled age. Reassure adolescents about the normality of the changes they are going through. When working with adolescents, remember their self-consciousness about their bodies and provide for privacy. Adolescents with family histories of genetic-related diseases such as cardiovascular disease, diabetes, or sickle cell trait should be screened as appropriate. Adolescent girls should be taught breast self-examination, and boys should be taught testicular self-examination. Peak age for testicular cancer is 20 to 35. Guide the teenager toward positive lifestyle choices and pay particular attention to misinformation that is common at this age and help correct it.
There are a lot of myths about STDs right now, but there are a lot of facts as well.
Realize that there may be some resistance to taking advice from an adult. Be considerate of how any treatment may affect the adolescent's appearance and relationships.
So what other things have you been worried about? Are there any other fears that you have right now?
Encourage questions about their fears and respect any expressed or implied religious or cultural beliefs. Many younger teens consider themselves magically safe from danger. Unconsciously, they often feel they are immortal, and they have no real sense of the risk about their behavior.
This is a good time to start thinking before things happen.
Interact with young teens with respect and offer honest answers about sexual and other risks.
Yeah, there are a lot of choices you have to make at your age.
Yeah.
Point out positive role models and reassure teens that they do not need to engage in risky behavior to belong. They will be respected if they make their own choices. By the late teens, from 16 to 18 years old, almost all teenagers will be at their adult height and development. Muscle development in boys and breast development in girls will be complete, and any change of voice in boys will have occurred. A sense of the future is arriving for many late teens. They are beginning to explore career options and possibilities for further education. Changes in their own lives, fears of the future, and problems with relationships can lead to depressions and mood swings. These can seem like lonely and traumatic years. Adolescents often need to balance developing their own identity with the need for very close relationships. Peer groups can come into conflict with family demands, and it can become a time of challenging authority. Many late teens are beginning to cut their ties with their parents, and they often develop fewer but closer friendships. Many also begin experimenting with what they see as adult behavior, including taboos such as smoking, drinking, and drugs. Dating and relationships become a major part of life, and a larger number of teens become sexually active by this time. For many late teens, life becomes hectic, and meal skipping and snacking become common, often snacking on unhealthy fast foods. Excessive weight and obesity are becoming increasing problems among teens.
So how's school going?
Physical assessment is the same as for adults, though late teens may still show an exaggerated self-consciousness about nudity and sexual questions.
So have you started dating yet?
Provide privacy and be sure to give a full explanation of the purpose and nature of any procedure. Continue to watch for any signs of common adolescent health problems such as nutritional disorders, STDs, pregnancy, or stress-related problems, and ask about family histories of any genetic-related diseases. Don't refer to late teens as children or boys and girls. They will often respond positively to being treated with the same respect as any adult. The healthcare worker should avoid any authoritarian approaches. Talk directly to the adolescent, not through the parents. Parental authority in general is no longer very effective as a strategy for discussing limits. Develop new strategies for late teens based on rational explanations and self-protection. Those in their late teens are at the very height of any tendency toward risky behavior, especially reckless driving, drinking, and sexuality.
Have you been sexually active?
They should be counseled about peer pressures and having the maturity to make their own choices. If self-protection doesn't seem to work as a counseling tool, healthcare workers should consider suggesting that teenagers have a responsibility as a role model for their own younger siblings and the younger students at school. Encouraging mature behavior and mature decisions in teenagers will help lead to a responsible young adulthood. This program has been a guideline for the age-specific care for toddlers through teenagers. These suggestions will help you integrate age-specific care into your work with persons of these ages. The adult ages will be covered in another program. Taken together, these techniques will help you learn what you can offer your patients at just that moment in their life journey when they need it most.